Time to get a check on some health headlines for the day, including concerns about illnesses over the holidays. Joining me is Dr. David Winter from Baylor Scott & White Health. Good morning, Dr. Winter.
Good morning, Tashara. Good to be with you.
Always. With more new cases of coronavirus is where we'll start being reported. It appears that a COVID surge is coming. A new variant, XBB, also circulating and maybe more contagious than the current strains of the virus. What are the implications of all of this? I know I said a mouthful.
Well, you know, I'm commonly asked, Tashara, is this COVID thing ever going to go away? But as you just cited, new variants keep coming on. We started with BA4, BA5 earlier in the year. Then there was BQ1.1. Now there's XBB. The virus keeps mutating, keeps changing. So I don't think it's going to go away. Now, the good news is all these new variants came from the original mutation, Omicron, which means all the vaccines out, including the bivalent vaccine, do work against it. And as all the doctors will tell you, people who've been vaccinated and get COVID have a mild case. The ones that haven't been vaccinated can have a really bad case. We're pushing vaccinations, yes.
Always, okay. Flu cases also steadily increasing, and total reported cases are higher at this time of the year than in recent history. What do you make of that?
Yeah, the flu season started earlier this year than usual. In fact, total number of cases this year are higher at this point in time than in the past 5 years. As a consequence, we're running out of these antiviral flu vaccines, or flu treatments, by the way. Tamiflu, that's where we can't get those now, and it's a real problem. So again, stay away from crowds, be careful out there because flu is out there, and if you get it, you may have trouble getting treatment for that.
Now, we have heard you talk about a triple epidemic this year. That includes RSV along with flu and COVID cases. What should we all be doing to protect ourselves? I know I just heard you mention, obviously, staying away from those large crowds.
Yeah, and the trouble with these things for us is trying to diagnose which is which because the symptoms tend to overlap. It's hard to tell, do you have COVID? Do you have influenza? Is it a common cold? What's going on? Well, I encourage testing right now because these rapid tests are good. And the treatment for COVID is different than the treatment for influenza and the common cold. So if you can get a test, fine. Otherwise, be careful around crowds. And I know you don't want to hear it, but these masks, they do work. Particularly if they fit well, they can help prevent the spread of all these viruses, Tashara.
Okay, I don't know who don't want to hear it, but I definitely want to hear it, Doc. Antibiotics also said to be in short supply. These do not treat the viral illnesses, do they?
No, they don't. And strep throat is out there also. I've seen several cases recently. That's a bacterial infection that requires antibiotics. So there's a run on antibiotics also. So just know that there's a lot of bad bugs out there right now. With holidays coming up, just be careful in crowds and watch yourself because one of those bugs may get to you and they're not fun to have during the holidays.
Not at all. Last question here, Doc. Some cases of COVID are now progressing into a condition that causes prolonged dizziness. This is the first I've heard of this. What are your thoughts on that?
Yeah, it's a new thing. It just came out actually in a research paper on Monday. It's called postural orthostatic tachycardic syndrome. Now that all means to say that when you stand up, you get lightheaded and dizzy, and you may even fall. Now you can get it after a COVID shot, but you're 5 times more likely to get this if you get the COVID infection itself. Treatment's difficult, mainly trying to hydrate because when you stand up, your blood pressure will drop with this condition, and you got a real problem. So another reason to try to stay away from getting COVID infection if you can.
Okay, Dr. David Winter from Baylor Scott & White Health. Always so good to hear from you. Thank you.